Assalamu alaikum. I'm Dr. J. Siddiqui, cause-based genomic homeopath, and you're watching ACC Health Channel. Today, let's talk about the ankle brachial index, which well known as the ABI test, and why it is important in peripheral artery disease, which can lead to the serious heart problem. A simple non-invasive test to assess blood flow to the legs and feet, in which we check blood flow difference between the arm and ankles. If your ABI score is below zero point 0.9, it means you have a serious problem. You might be a blockage in your arteries or your arteries getting narrow. The reducing oxygenatic blood flow to your lungs. The sign and symptom: if you observe pain in legs, numbness, slow healing wound, diabetic, high blood pressure, history of smoking and alcoholism, then it is necessary. By doing the test regularly, you can protect your heart arteries from serious risks. The trial medicine, the treatment plan, how to get your blockage free your arteries. Arnica 1 ml, 5 drops in a quarter cup of water, alternate days in morning. Brightmeaver 30 TDS, 5 drops in a quarter cup of water daily. Gilonium or Gilonine 200, 5 drops in a quarter cup of water at night. In the next program, we will discuss the ABI test performance, how to perform the ABI test. Thank you for watching ACC Health Channels. Don't forget to like and share and subscribe for more expert advice. Thank you. Allah Hafiz. Assalamu alaikum.